No holiday from bad news about the president's health care program. Today, another long-term major delay ahead of another short-term deadline. This is Special Report. Good evening, I'm Doug McKelway in for Brett Baird. Despite the holiday, there is plenty of work to be done on the president's beleaguered health care website. That's because the promise for the new and improved version is Sunday. And today, we learned another milestone date has been pushed back a year. White House correspondent Wendell Goldert has tonight's top story.
Under other circumstances, President Obama might not have been happy with the distraction. But with time running out on his promise to repair the healthcare.gov website, and with problems persisting, the Thanksgiving holiday was welcome. Aides say the big push to have a lot of people try to enroll the first week of December has been put on hold. One official said, quote, "We want to see how traffic is the first week before we suggest people do campaign efforts to drive traffic." Critics saw another failure.
The website, they're saying, can handle 50,000 users concurrently, which is far less than what they originally anticipated, and which may or may not be accurate.
Officials also announced a one-year delay in the ability of small businesses to enroll their workers through the website, though they can still enroll them on the phone and in person. The National Federation of Independent Business said, quote, "Small businesses continue to be low on the priority list during the Obamacare implementation process." And in a telephone conference call, an administration spokeswoman suggested there will still be glitches in online signups after November 30th.
It is not a magical date. There will be times after November 30th when the site, like any website, does not perform optimally.
Democrats in Congress who are up for re-election next year want more certainty. Some have asked the president to appoint an Obamacare czar and are asking their colleagues to use the Thanksgiving recess to find Affordable Care Act success stories back home.
Every little step that the president and the administration can do to build up credibility that they've lost clearly in the fiasco of the website launch, they need to do.
White House Chief of Staff Dennis McDonough has been meeting with Democrats every week to try and ease their concerns, but President Obama's aides heard new concerns from doctors they met with at the White House this week who say Obamacare limits health care options for their employees, their own access to networks from which they attract patients, and more.
I am going to now be forced into this much more limited network, and in addition to having less doctors to choose from, I was also told that my choice of prescription drugs that would be covered would also be limited.
Republicans see a pattern of the Obama administration delaying parts of the Affordable Care Act that it has trouble implementing, but refusing to delay parts that are inconvenient for health care subscribers. The White House sees wrinkles, which it's betting will be ironed out by this time next year. The Republicans are betting not. Doug?
Wendell Goldert on the North Lawn. Thank you, Wendell. One of the major selling points for the plan was the subsidy aimed at blunting the effects of the higher premiums. Chief National Correspondent Jim Engel tells us tonight that the theory does not necessarily translate into reality.
One of the frequent refrains from the administration over repeated complaints about sticker shock for those forced into Obamacare is that subsidies will make it all affordable. But new research is calling into question how much subsidies will actually dull the pain of sticker shock.
It'll turn out that two young people in different places get very different subsidies, one zero, one not. You look at a young person versus an old person, the subsidies will be very different. It's going to produce a lot of confusion about what constitutes a fair federal program.
A lot of people are not going to be getting subsidies, even though they've been told that, if they make less than 400% of the federal poverty level, which is just under $46,000 for a young person, for a single person.
And just over $94,000 a year for a family of four. But determining the subsidy is far more complicated than just income level. It depends on where one lives, which plan one chooses, the amount of premium and income. David Hochberg uses the example of two 27-year-olds in Chicago with similar incomes.
If you earn $25,000 a year, you will get a small subsidy to put toward health insurance. If you earn around $27,400 a year, you've reached an income level where you're no longer getting a subsidy.
The confusion over subsidies and the fact that many young people of low income may not get them could increase the incentive for some young healthy people not to sign up at all.
They don't spend on health care. Why do they buy insurance? Well, only if they're given a subsidy and an incentive to do so.
Not only that, subsidies only help reduce the cost of premiums themselves, but much of the cost of insurance under Obamacare comes from high deductibles and copays.
The deductibles, $5,000, $6,000, $7,000 a year. It really does make you wonder, am I really better off by getting insurance?
It's one more incentive that this law creates to discourage young and healthy people from signing up for insurance.
The success of Obamacare turns on how many young and healthy sign up, and that depends on their assessment of the costs and risks of signing up for Obamacare or paying the penalty and getting other insurance or none at all. Either way, several analysts argue many people will soon realize the promise of subsidies for everyone at a certain income level, like other assurances in Obamacare, may not hold true for everyone. Doug?
We'll see in the coming months. Jim, Thank you. The Obama administration wants the IRS to rein in tax-exempt political groups. And if you think that sounds a lot like the recent targeting scandal against conservatives, you are not alone. Here's Chief Congressional Correspondent Mike Emanuel.
With Congress still investigating the IRS targeting of conservative groups, and in the wake of the Supreme Court's Citizens United ruling on political speech by corporations, associations, and unions, the tax collection agency has proposed new rules to limit political activity of social welfare 501c4 organizations. Assistant Secretary for Tax Policy Mark Mazur said, quote, "This proposed guidance is a first critical step toward creating clear-cut definitions of political activity by tax-exempt social welfare organizations." This comes just months after Lois Lerner, who headed the IRS Exempt Organizations Office, blamed IRS employees in Cincinnati for the targeting. Lerner has refused to answer questions on Capitol Hill and ultimately resigned in September. House Oversight Chairman Darrell Issa says these new rules could hurt the little guy.
Small grassroots organizations, perhaps an organization that's simply trying to speak out against some company hurting pets or small animals, could find themselves objecting to political speech. Well, a trade association or a union is completely exempt from these rules.
Ways and Means Chairman Dave Camp says his committee should be allowed to finish its probe, and the agency should not be rushing new rules.
It'll have a huge impact on political discourse, political speech, and I think anything we look at should not be restrictive of free speech in the political process. It looks as though it's going to just quiet critics of the administration.
Some Democrats are saying it's important to address this issue after more than $300 million were spent by tax-exempt organizations in the last election. Maryland Democrat Congressman Chris Van Hollen says, quote, "The public has a right to know who is spending millions to influence the outcome of our elections, and we must put an end to this flow of secret money." But Karl Rove, who helped found Crossroads GPS, says Democrats didn't have a problem when it was groups backing them.
It is hypocritical, and it's interesting that it only started to happen when conservatives started to do what liberals have done for decades.
Based on initial reaction, it's clear these rules are going to be a huge fight. It's thought they won't be in place for the 2014 cycle, but would likely be a factor in the 2016 presidential election. Doug?
Mike Emanuel. Thank you, Mike. Stocks headed into the holiday on a high note. The Dow gained 24.5 for another record close. The S&P 500 up 5. NASDAQ gained 27. Up next, new images and documents from last year's Benghazi terror attack. But first, here's what some of our Fox affiliates are covering tonight. Fox 5 in Las Vegas on a judge's decision to reject O.J. Simpson's request for a new trial. Simpson contended his defense was inadequate in his robbery trial in 2008. Fox 4 in Dallas with another judge's ruling, moving a merger between American Airlines and U.S. Airways a little closer to reality. And this is a live look at Atlanta's Hartsfield-Jackson Airport from Fox 5. The big story there tonight, another huge holiday travel day at the world's busiest airport. That's tonight's live look outside the Beltway from Special Report. We'll be right back.